James, welcome to the interviews. I have a scenario for you.
Yeah.
So, a patient has come to you, they've got chest problems. They're coughing, they're feeling short of breath. So, as part of your tests, your investigations, you feel like they do need a chest x-ray. But your patient is refusing because he thinks that x-rays are harmful to his health.
Right.
What do you do in this situation?
Okay. So, for the patient's health, I think we're considering giving him an X-ray, but he isn't wanting that. So, I think initially the first thing that I'd want to consider is, the underlying root cause of this. So, why exactly does he not want to? So, I'd want to sort of understand and put myself in his own situation, in his situation, and understand sort of maybe what has gone wrong in the past that's sort of led to this, potentially miseducation or misinformation that he's read, or whether it be he's had a bad experience with x-rays or he's heard something from a friend or something, or a family member that they're not good for his health. So, and it's important that, he is exactly aware of what happens in an x-ray and the actual health risks of it, potentially sort of, if he was to have many x-rays, maybe this could actually cause a problem, but actually it's for relatively safe nature of x-rays in low dosage and things like that. So ensuring he understands the sort of intricacies of the treatment, and seeing, just so we can actually see what exactly is going on, and potentially there being a bigger problem underneath which the x-ray could release, so that would outweigh the negatives of getting the x-ray. I would be able to sort of uncover this problem that he's been facing and potentially be able to help him. I think I'd also consider sort of, if he's still reluctant past this point after, exploring these options, then potentially we'd move on to looking at, other treatment options like other scans, so ultrasound, MRIs, CTs, potentially. Or just some like non-invasive procedures if he just doesn't like the idea of being scanned for things. I think it's important that we also assess sort of, his competence, like how old is he, how sort of, how much capacity does he have over these decisions? Is he delirious? Can we assess that as well?
Okay.
Can we get a baseline from his family? Things like that. Just to sort of get an idea of, is he in the right state of mind to be making these decisions about his health? And I'd also consider sort of bringing in some external opinions, maybe some more experienced doctors could help me make the decisions, or nurses, people in the MDT. So working as a team to sort of discuss this issue and sort of find out what the best course of action would be moving forward for the best patient care possible.
Sure. Okay. Are you done?
Yeah, I just think, so overall, I'd just sort of say, I think it's important that we sort of assess the situation with empathy and we go in and we, are able to understand things from his point of view and, respect his autonomy in this decision. That, if he doesn't want the x-ray or a scan, he doesn't want it. And if he has the capacity to make that decision, that's his decision to make. And we must respect that as doctors and ensure that we can, provide him the best care possible without this. So think of alternative plans moving forward. So, yeah.
Okay, yeah, thank you for that. So then the next point I want to touch on, I think you've alluded to it earlier, and that is here there's something about patient autonomy, but there's also something about doctor's autonomy. Can you discuss that a bit more in depth, please?
Yeah, so if this patient has actually got competence and has got capacity to make these decisions, I think it's important that, you are able to let him enforce that. However, there is clinicians' autonomy in the sense that they are they're qualified people, and they are able to make decisions based on, the well-being of the person. I mean, it's for the greater good of their health that they were to receive this X-ray. So, in a sense, if we weren't able to gain this a gauge on like how how much capacity they had, and there wasn't any family members to help us make this decision, I guess the clinician could have some autonomy here to sort of help push this patient towards, getting a diagnosis and seeing what's going wrong. Because they do have some authority over the patient's care and determine like sort of what treatments they can give out and things like that. So they do have some control over that care.
Sure. Understood. Thank you. That was a good effort. Thank you very much. Okay, James. So, how did you feel about that?
I think it was okay. I preferred the first question to the second question. I feel like I got a bit stuck talking about clinicians' autonomy. I'm not quite sure how much autonomy they have over. Like, obviously, they can sort of give out what treatments that they feel are necessary, and they won't give out something if they don't. If the patient's demanding something that they don't think they need, they won't be able to. It's their autonomy to give that treatment. Whereas, but when it's actually coming to going against the patient's wishes, it's a difficult situation.
What if the patient says, "Well, actually, doctor, I don't want an X-ray, but I'm happy to have an MR scan. It's magnets. There's no X-rays involved. I'm happy to have an MR scan instead of an X-ray." How do you respond to that? What's the doctor's autonomy here?
Well, do you actually think, there's a few considerations to make. So, would we be able to see this on an MRI scan? Potentially, it's a different machine. Would it show up?
So it might not be.
It might not be useful. Are you therefore wasting sort of these people's time and NHS resources by putting this person in for an MRI? And could other people be potentially using that MRI machine while it's almost, so you've got to think about justice in that sense, like are we using that in a fair regard? So the doctor's got to think, do you actually need an MRI? Will it actually tell us anything? So, you've got to assess it critically as well. And I think that it isn't the doctor's right to actually deny the patient of that treatment if it's not applicable for this situation. I mean, if it is, chest pains, potentially an MRI could be quite useful. So I think so. I think that it is the clinician's autonomy whether to give that treatment out or but
And so there you considered, is there a actual clinical need?
Yes.
You also considered something about finances. As in fairness of equity of use resources, and if potentially someone else could be denied access and the resources of an MRI.
Yes.
Which you're going to use up with this patient, aren't you?
Yeah.
Good. Excellent. What do you guys think?
I think it was a really good attempt. You got everything across.
Yeah.
And I think compared to mine, you did it all step by step. So you could tell that you were following it through.
Yeah.
And building up to it, and you were making sure the patient was being reassured.
Yeah.
All the way through.
Smile, yeah? Do you agree?
Yeah, I think it was really good. I liked how you went into different perspectives, really thought of every single scenario possible.
Absolutely.
This could be here. And maybe.
Are you starting to get the picture now?
Yeah.
What's the game that they're playing? It's a game, isn't it? It's a game. Just know how they play the game. And that's it, bat them off.
In the interviews, is it maybe that we'll have one question that's just a minute and another completely different question, multiple questions, or is it really just...
Good question, that. Good question.
Depending on the uni.
This is pretty much how it's done, which is you'll have a headline, like a scenario or a question, but then they tend to follow it with one, maybe two, a bit like I did here. So initially it was, what do you do in this situation? But then I wanted to emphasize the ethical consideration of autonomy here, which you answered really well, by the way. But I could have took you down another rabbit hole, and it could have been something to do with conflict of interest. As I did with the second time, I said to you, well, if your patient wants an MR scan instead, what would your thinking be? And you rightly thought about three things. One is, will it improve my chances of detection or whatever I'm doing here? And if the answer, I think, is no to that, then why am I doing it? You're thinking, hang on, this is going to cost something. Especially, and you can make some wild guesses here. Do you not think an MRI costs a lot more than an X-ray? Yeah.
Definitely.
Yeah, at least 300 times more.
Yeah, 30 minutes in that machine. The electricity.
Absolutely.
And
You're
the
talking-
people and the staff actually sat outside watching you basically get it done.
Yeah, you're talking an X-ray which costs the NHS really cost price, which probably isn't even 50 quid by the time you've took the person's time into account, the radiographer.
Less staff
Really?
too, I guess.
Yeah.
She's a nurse.
Yeah,
Yeah.
50 quid maybe, if that, as opposed to an MR scan, 800 quid. You know, it's a huge difference in resources. And even that's probably subsidised. I mean, I don't know if that includes electricity and everything.
Yeah.
You know. Yeah, so because the only reason I'm saying that is because if you go private, you're not going to get that scan for 800. You'll probably pay a good 1,600, 2,000 for that. So it's a lot more privately because they'll take into account electricity and blah 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 and rates and rents and so forth. Yeah, brilliant. I think you can see. You know, I just want to say both your answers are strong. Believe me, you need to say that to yourself, Eliza. Your answer was good. You know, you don't get negatively marked for pauses, you know.
I don't think there's anything wrong with that as long as you're sort of thinking about, you know,
Yeah.
like it's
I'd rather you paused, gave yourself time to think about things, than some people who just keep on going on about the same thing in lots of different ways. They waffle, you know. I don't think you waffled much at all, because what I tend to do is tally. If I see you making the point again under a different way, I tend to put a tally number next to it, and I haven't done that with you. You know, I've actually listed quite a few different things that you brought up. So, and there wasn't much repetition going on. You know, I think you need to say to yourself that actually I'm pretty good. I think that's my main feedback to you. I feel you want to say to yourself, I'm not good. I think you're as good as all three lads here. Yeah. I think, yeah, we need you to say, oh, all right, I can give this a good bash. You know.
Is it like, so it's all the time it's the case that they're like ticking off like a mark scheme that they've
Yes.
got alongside? It's not where the person gets like a sense of, oh, I like the vibe.
Yeah.
And the person has like a sense of like saying,
I like him.
I like the vibe. It's more of like,
That's how it used to be. Back in the days, it was very much on examiner, interviewer interpretation of
so now
things.
it's not like that at all.
No, it's very much grid marked. You know, so like with this question, has there been something about? Are they talking about why the patient wants no X-rays? Have they explored the patient's thinking? You know, patient's perspective. Do you get it? There'll be definitely something about ethics here. They think about autonomy. There's something about the doctor's autonomy. Definitely, I can guarantee you there'll be some marks for that. There'll be some marks here about decision making capacity, because they've not said how old or anything here. As you rightly said, was it you? I can't remember. Somebody mentioned delirium. You know, are they incapacitated in any way? Have they got capacity to make a decision? So, you know, one of your big C's comes in. Empathy came in. Yeah, both of them mentioned empathy in that. You know, so those are the kind of things, those are the elephants, so to say, they're looking out for. And all they want you to do is describing, gets marks, but better still if you underline it, label it. You know, like you did, empathy, say it. Like you did, don't say things like, oh, we need to make sure the patient has a right to make their decision, etc. Well, say the big word, which is capacity, which is can they consent?
So
You know.
even if you're pointing out the obvious, you suggest to just say the word rather than
Bring it in.
yeah.
This is no different, by the way, to how you guys been marked in A-level and GCSE.
Yeah, that's what I was thinking because like
Yeah.
I do a language.
Yeah.
And a lot of the times the things I'm saying are just way better, but they just aren't part of the mark. Well, that's obviously my opinion. But like I am saying things that are more spot on to the country and to the things which are relevant.
Yeah.
But it's like so much better than what they would have expected, and then it's just like, oh, it's not on the mark scheme. It's just a bit like, even if you know it, just really try to think what they want and play along with them rather than like.
Absolutely, absolutely. And the more I find my colleagues like yourselves, my students do this, the more you practice, you start to keep that embeds in your head, and it kind of makes you think about all the different aspects.
Yeah.
You know, you're casting that net wide. so you catch as much as you can, basically. You know. All right. Good. Who wants to do the one that Eliza didn't want to do? Go on. You get to pick.